I am Dr. Enesi, and I am happy that you are here with me today. I am an interventional neuroradiologist. I have finished my studies in 2008 in General Radiology, and after that there are two of my professors, Professor Vreto and Professor Petrela, that proposed me to do another subspecialty, which was the interventional neuroradiology. 2009, I have been accepted by Professor Emmanuel Houdart in Lariboisière Hospital in Paris. I started the interventional neuroradiology for 2 years in 2009 till 2011. And after I came back in Tirana, when I started to work in the treatment of the vessels pathologies that are connected with the vessel damage, such as hemorrhage, and also pathologies that came from the occlusion of the vessels. He's saying that I am working with a stroke in the American hospital. Advantages are three. The first is humanity. We have people here that will work every day and discuss everything. So we work in strength connections with neurosurgeons, neurologists, cardiologists, intensive care units, and physiotherapists. So we discuss together the cases, because the patients that come for basal brain diseases, most of the time they have other coexisting diseases like diabetes or hypertension or cardiac pathologies. So we need to discuss with them, because in the most of cases the pathologies are connected. And the second thing is the technology. So the technology here is in the top, because we have the facility to have in the fastest time our possibility to do the CT scan, the angioscan, the perfusions, to have the MRI any time in emergency, the ultrasound, and what is most important, we have the best B-plan machine here, and we are working hard to have a second one for backup, or also if there are patients that came in the same time, so we can give them the possibility to be treated. And the third thing is the academic possibility, because when we work with people that knows their job, we can do scientific papers, and we can publish them. We can fulfill what all of those are the things demanded by the European community in the era that we live now. The pulsatile tinnitus, it's let's say it's also a family affection by the master that I have learned this job. As the Professor Emmanuel Houdart is one who has developed this pathology, I have take from him the possibility to treat this disease in Albania. The pulsatile tinnitus is a tinnitus that is like a heart beating near the ear. There are a lot of kind of tinnitus, but the tinnitus that we are interested in is that it was pulsating. It has some clinical characteristics, like is the sound, which is pulsatile. It's like, and also there are some objective examinations, like is when we compress in the neck, in the side of the tinnitus, it stops, and when we do imaging scans like CT scan or MRI, we can change these symptoms in an objective science. So we can, most of all, we can see a large vein in the brain, which is called transverse sinus, when we see in the MRI the narrowing of the vein. In some other times, when the tinnitus is connected with the vessels, we see the bone thickness in the side of the tinnitus. Some other times there are other pathologies connected with the tinnitus, like arteriovenous malformations, and some other times maybe there are tumors which may give the tinnitus. After the diagnosis, it comes the treatment. So to treat the treatment is done by the endovascular way. What we do is that we enter by two ways. One is the arterial way and the second is the venous way. The arterial way may be by the radial axis or femoral axis, and the venous is by the jugular vein that we puncture in the side, the jugular vein in the side of the tinnitus. We use this way to put up the stent in the narrowing side of the vein. The procedure mostly is being done in the general anesthesia, and during the procedures we also take the measurements of the pressure before and after the stenosis. And in the end of the procedure, the patient is wakened at the intensive care unit, and it is directly after that that we asked him about the tinnitus. Does he has not the tinnitus? And when the things are well, so the patient can go out of the hospital the same or the maximum the next day of the treatment. Better diagnostic is to inform the people about that this disease is curable. There are small things that we have to learn to the citizens to compress the neck in the side of the tinnitus, and if the sound is reduced, so they have to come and see us for the solution. The second thing is to speak to the young doctors that this treatment is to teach them how to diagnose it and how when to send the patient to be treated. And the third thing is also to write and to discuss and to put this diagnosis in the books of the medicine books, so everyone can learn about this diagnosis. About the treatment, we have to specify the hospital and the names of the doctors who are capable to do these treatments. Another way to certificate the persons who are in charge to do some kinds of treatments. I think this kind of tinnitus, we have to tell the patient to imitate to the patient the rumor. If the rumor is continuously, so this is not a pulsatile tinnitus. If the rumor is yes, this is a pulsatile tinnitus, and these are the patients that should have to come at us and to discuss about the solution. When the pathology is completely vascular, is up to us to diagnose by imaging scans or ERMs to see where the damaged vessel is and to give them the possibility to be treated. It's not a neurologist who can find the vessel that is damaged. It's not an ENT that can find the venous, which is stenosis, because it is inside the skull. And it is not a psychiatrist who can find the solution, because it is a mechanical problem. So it is up to us that knows very well the anatomy of the vessels in the brain that could find the solution of these symptoms. I'll be honest, but before the Professor Emmanuel Houdart developed the disease, no. Because now we understand better this disease, and now we have the solution. We have a lot of patients to be diagnosed and to be treated. I cannot talk about all the Balkan, but we can speak about Albania and Kosovo. We are around 4.5 million. Maybe we can say to 10,000 to 15,000 people that have pulsatile tinnitus. There are around of 70% of people that we can treat it, because is a number of 30% that we have not the diagnosis, and there we cannot propose a treatment. I would like say to them to continue asking for a solution, because now we have made a lot of advances in the diagnostic and in the treatment of this disease, and they can come to see us if they have pulsatile tinnitus, because today we have the solution for them.